Have you ever noticed that one of your legs feels heavier or swollen for no clear reason? Like your sock leaves a deep mark that stays for hours. What if this started during your teenage years, even though you didn't hurt yourself or have surgery? This could be a sign of primary lymphedema, especially a type called Meige's disease or lymphedema praecox. Unlike swelling from an injury or infection, this happens because your body's natural drainage system, like tiny sewers under the skin, didn't form quite right from birth. It often shows up around puberty and mostly affects the legs. Think of it like a clogged pipe that slowly causes water to build up in your floor. It's not sudden, but it grows over time and can make walking or wearing shoes uncomfortable. The good news, you're not alone, and understanding it early helps you manage it better. So why does this happen? Imagine your body has a hidden network of tiny rivers called lymph vessels. These rivers carry away waste and extra fluid to keep your tissues healthy. In primary lymphedema, especially Meige's disease, these rivers are either missing, too narrow, or not connected properly. And this is something you're born with. It's not caused by infection, cancer, or surgery. Those cause secondary lymphedema. Instead, it's due to a genetic typo that affects how your lymph system develops. Sometimes it runs in families, but often it appears out of nowhere. Think of it like a factory making cars. If a part is missing during assembly, the car might still run, but not as well. Similarly, your lymph system is built with a flaw from the start, and symptoms show up later, often around puberty when your body goes through big changes. How do you know if it might be you? Let's play a quick check. Do your legs feel tight or achy by the end of the day? Does your skin look thicker or harder, especially around the ankles? Have you noticed that one leg is clearly bigger than the other, even in shoe size? You might also see little pitting. Press your finger on the swollen area and a dent stays for a few seconds, like poking a water-filled sponge. Some people say their legs feel full or wooden. Early on, the swelling might go down overnight, but as time passes, it stays. For women, it often begins around age 10 to 15, during puberty. If you've had these signs for weeks and no injury explains it, it's worth talking to a doctor. Ignoring it can lead to skin infections or long-term discomfort. No single test shouts you have Meige's disease. Instead, doctors piece clues together. They'll check your medical history, especially whether swelling started young and without injury. Then they use imaging like an MRI or a special test called lymphoscintigraphy, which tracks how dye moves through your lymph vessels like watching traffic flow on a highway to find the blockage. Once they confirm poor drainage, the treatment isn't about a quick fix, but daily habits. The most effective compression therapy, wearing tight medical-grade socks or sleeves to push fluid out. Think of it like squeezing a sponge to release water. Other tools include manual lymph drainage, a gentle massage done by trained therapists, keeping skin clean, and moisturized to avoid cuts, and exercises like swimming or walking to use muscles as natural pumps. In some cases, specialized pumps or surgery may help, but there's no cure yet, so management is key. Since primary lymphedema is something you're born with, you can't prevent it like you would a cold. But you can prevent it from getting worse, like wearing good shoes to avoid blisters or avoiding standing too long without moving. Think of your legs like delicate machines. Treat them gently. Keep your skin clean and moisturized, because dry or cracked skin is an open door for infections. If you cut yourself, clean it fast and watch for redness or fever. A small cut can turn into cellulitis, a serious skin infection, if your lymph system isn't working well. Also, don't ignore early swelling. Starting compression early can delay complications. Avoid very hot baths or saunas. They make swelling worse. The goal: stay active, stay clean, stay aware. It's not about fear, but taking smart care every day. Good news, science is moving. Researchers are studying genes linked to lymph system development. In a few families, changes in the FOXC2 gene were found to cause Meige's disease. This helps doctors test at-risk family members early. New imaging tools now show tiny lymph vessels in amazing detail, helping tailor treatment. Some clinics are testing wearable sensors that track swelling over time, like a fitness watch for your leg fluid. Most exciting, early experiments with regenerative medicine, like growing new lymph vessels using stem cells, are being tested in animals and small human trials. It's not mainstream yet, but gives hope. Also, better compression garments are being designed, lighter, cooler, and more comfortable. So while today's care focuses on managing symptoms, tomorrow may bring ways to repair the